This is a NCLEX practice test for physiological adaptation. The practice test covers a variety of topics related to how the body adapts to changes in its environment. These changes can be external, such as temperature or altitude, or internal, such as stress or illness. This test measures your knowledge of how the body responds to these changes and how you can care for patients who are experiencing them. Let's get started. 1. A client is in need of hemodialysis for end-stage renal failure. The physician has inserted an AV fistula. Which of the following nursing interventions are appropriate when caring for this access site? A. Assess for clotting in fistula tubing. B. Apply a dressing over the fistula site. C. Assess for a bruit or thrill at the site of the fistula. D. Assess circulation proximal to the fistula site. Correct answer: C. Assess for a bruit or thrill at the site of the fistula. An AV fistula internally connects an artery and a vein. The site is accessed by venipuncture when used for hemodialysis. The nurse should auscultate for the sound of a bruit over the site or palpate a thrill at the site to ensure that it is patent and ready to use. 2. An 85-year-old client is diagnosed with hypernatremia due to lack of fluid intake and dehydration. The nurse knows that symptoms of hypernatremia include: A. Lack of thirst. B. Pale skin. C. Hypertension. D. Swollen tongue. Correct answer: D. Swollen tongue. Hypernatremia among elderly clients may be caused by dehydration and lack of fluid intake. Hypernatremia results in sodium levels greater than 145 milliequivalent/L. The most common symptoms of this condition are mental status changes, a thick or swollen tongue, excessive thirst, and flushed skin. 3. A client is brought into the emergency department after finishing a course of antibiotics for a urinary tract infection. The client is experiencing dyspnea, chest tightness, and is agitated. Her blood pressure is 88/58. She has generalized hives over the course of her body and her lips and tongue are swollen. After the nurse calls for help, what is the next appropriate action? A. Start N4 and administer a 1-liter bolus of lactated Ringer's solution. B. Administer 0.3 mg of 1:1000 epinephrine IM. C. Administer 15 mg diphenhydramine IM. D. Monitor the client until help arrives. Correct answer: B. Administer 0.3 mg of 1:1000 epinephrine IM. A client experiencing an anaphylactic reaction will most likely present with rash or hives, swelling of the lips, face, or tongue, hypotension, or dyspnea. A client who is experiencing breathing difficulties should rapidly be given an intramuscular injection of 0.3 mg of 1:1000 epinephrine to relax the muscles of the airway and facilitate better breathing and increased oxygenation. 4. A nurse is assessing a client who is post-op day number 3 after an abdominal hernia repair. After a bout of harsh coughing, the client states, "It feels like something gave way." The nurse assesses his abdomen and notes an evisceration from the surgical site. What is the next action of the nurse? A. Turn the client on his side. B. Push the abdominal contents back inside the wound using sterile gloves. C. Ask the client to take a breath and hold it. D. Cover the intestine with sterile saline dressings. Correct answer: D. Cover the intestine with sterile saline dressings. A wound evisceration occurs when the edges of an abdominal wound separate, allowing the coils of the intestine to protrude outside of the body. The nurse should notify the physician at once if this occurs. While waiting for treatment, the nurse should cover the intestines with sterile gauze soaked in saline. 5. A nurse is performing CPR on a client when a coworker brings an automated external defibrillator, AED. The nurse prepares to apply the patches to the client's chest when she notes that he has a large amount of thick chest hair. What is the next action of the nurse? A. Apply the pads to the chest and provide a shock. B. Wipe the client's chest down with a towel before applying the pads. C. Shave the client's chest to remove the hair. D. Do not use the AED. Correct answer: C. Shave the client's chest to remove the hair. In most cases, AED pads will adhere to a client's chest, even if he has chest hair. In cases of thick chest hair, however, the AED pads may not conduct current properly. Many AED kits contain a razor, allowing the nurse to shave the area of the chest to apply the pad. The nurse should act quickly and limit time spent preparing the client. 6. A nurse is educating a client who was recently diagnosed with diverticulosis. What types of foods should the nurse recommend for this client? A. Whole grain cereal. B. Eggs. C. Cottage cheese. D. Fish. Correct answer: A. Whole grain cereal. A client with diverticulosis has a condition that causes small protrusions in the intestinal tract. If the protrusions become infected or inflamed, the condition is called diverticulitis. Diverticulosis can be managed by a high-fiber diet, and the nurse should recommend foods that contain fiber such as whole grain cereal, fruit, such as apples or prunes, or vegetables, including beans, squash, or cauliflower. 7. A client is brought into the emergency room where the physician suspects that he has cardiac tamponade. Based on this diagnosis, the nurse would expect to see which of the following signs or symptoms in this client. A. Fever, fatigue, malaise. B. Hypotension and distended neck veins. C. Cough and hemoptysis. D. Numbness and tingling in the extremities. Correct answer: B. Hypotension and distended neck veins. Cardiac tamponade occurs when fluid or blood accumulates in the pericardium, preventing the heart from contracting properly. Cardiac tamponade results in decreased cardiac output and is a medical emergency. Symptoms of this condition include low blood pressure, distended neck veins, chest pain, and muffled heart sounds. 8. Which of the following descriptions best describes the function of the thyroid gland? A. The thyroid gland converts glucose into glycogen. B. The thyroid hormone secretes cortisol during times of stress. C. The thyroid gland regulates body metabolism. D. The thyroid gland affects skin pigmentation. Correct answer: C. The thyroid gland regulates body metabolism. The thyroid gland is responsible for secreting thyroxine, T4, and triiodothyronine, T3, which work to regulate metabolism of the body's cells. The thyroid also regulates carbohydrate, protein, and fat metabolism, as well as regulates both physical and mental development. 9. A client in the ICU has been intubated and placed on a ventilator. The physician orders synchronous intermittent mandatory ventilation (SIMV). Which statement best describes the work of this mode of ventilation? A. The ventilator delivers a set rate and tidal volume regardless of whether the client is attempting to breathe. B. The ventilator coordinates delivered breaths with the client's respiratory efforts. C. The ventilator provides a supplemental breath for every third breath of the client. D. The ventilator provides breaths during the expiratory phase of the client's respirations. Correct answer: B. The ventilator coordinates delivered breaths with the client's respiratory efforts. Synchronous intermittent mandatory ventilation, SIMV, is a ventilation mode that coordinates delivered breaths with the client's own respiratory efforts. The delivered breaths from the ventilator have preset pressures as ordered by the physician. This type of ventilation may be used among clients as a standard form of ventilation or to wean from the ventilator. 10. A client is seen for testing to rule out Rocky Mountain spotted fever. Which of the following signs or symptoms is associated with this condition? A. Fever and rash. B. Circumoral cyanosis. C. Elevated glucose levels. D. All of the above. E. Both A and D only. Correct answer: A. Fever and rash. Rocky Mountain Spotted Fever, RMSP, is caused by the R. rickettsia pathogen and causes damage to the blood vessels. A person with RMSP may present with fever, edema, and a rash that starts in the hands and feet and then spreads throughout the body. The condition starts after a bite from an infected tick. 11. A nurse is caring for a newborn infant in the nursery who has developed vomiting, poor feeding, lethargy, and respiratory distress. The physician has diagnosed this infant with necrotizing enterocolitis. Which of the following nursing interventions is most appropriate for this infant? A. Feed the infant 30 cubic centimeters of sterile water. B. Position the infant on his back. C. Administer antibiotics as ordered. D. Allow the infant to breastfeed. Correct answer: C. Administer antibiotics as ordered. Necrotizing enterocolitis, NEC, occurs when part of the bowel becomes ischemic, causing gastrointestinal problems, periods of apnea, lethargy, and poor feeding, and potentially sepsis and death. A nurse caring for an infant with NEC should stop oral feedings, insert a nasogastric tube, and administer antibiotics as ordered. 12. Mr. C is brought to the hospital with severe burns over 45% of his body. His heart rate is 124 bpm and thready, BP 84/46, respirations 24/minute and shallow. He is apprehensive and restless. Which of the following types of shock is Mr. C at highest risk for? A. Septic shock. B. Hypovolemic shock. C. Neurogenic shock. D. Cardiogenic shock. Correct answer: B. Hypovolemic shock. A client who has suffered severe burns may be at risk of hypovolemic shock. Burns cause a loss of plasma volume, depleting the amount of fluid in circulation, decreasing perfusion to essential organs and to the extremities. 13. Based on Mr. C's assessment, which of the following nursing interventions is most appropriate? A. Elevate the lower extremities to 45 degrees to promote venous return. B. Place Mr. C in the Trendelenburg position. C. Administer total parenteral nutrition. D. Monitor urine output. Correct answer: D. Monitor urine output. A client in hypovolemic shock may have decreased urine output related to poor kidney perfusion. The nurse should administer fluids as ordered and monitor urine output to ensure that it remains above 30 cubic centimeters per hour. 14. Mr. L was working in his garage at home and had an accident with a power saw. He is brought into the emergency department by a neighbor with a traumatic hand amputation. What is the first action of the nurse? A. Place a tourniquet at the level of the elbow. B. Apply direct pressure to the injury. C. Administer a bolus of 0.9% normal saline. D. Elevate the injured extremity on a pillow. Correct answer: B. Apply direct pressure to the injury. When a client is seen for an injury that causes excessive bleeding, the first action of the nurse is to apply direct pressure to the wound. Firm pressure with a sterile dressing can be applied while the rest of the emergency team works together to stabilize the injury and prepare for surgery. 15. A client is admitted for a head injury. His body is lying in an abnormal position and the physician states he is exhibiting decorticate posturing. Based on this assessment, the nurse can expect to find the client with A. The legs extended and rotated internally, the elbow, wrists, and fingers flexed. B. The legs pulled toward the chest, the head bent back at a 30-degree angle. C. The back arched, the arms and legs extended and rigid. D. The legs extended and rotated externally, the head turned to the right or the left. Correct answer: A. The legs extended and rotated internally, the elbow, wrists, and fingers flexed. Decorticate posturing indicates an injury to the corticospinal tract. The client may exhibit this posture unexpectedly or it may develop when the client's body is stimulated. A client who exhibits decorticate posturing lies with the legs extended and rotated internally, the elbows, wrists, and fingers are flexed inward. 16. All of the following signs are indicative of increased intracranial pressure except A. Decreased level of consciousness. B. Projectile vomiting. C. Sluggish pupil dilation. D. Increased heart rate. Correct answer, D. Increased heart rate. A client with increased intracranial pressure may develop life-threatening complications if the condition remains untreated. The nurse should be aware of early signs of this condition among clients at risk to avoid herniation of brain tissue. Signs of increased intracranial pressure include decreased level of consciousness, decreased heart rate, abnormal respirations, sluggish pupil dilation, and projectile vomiting. 17. A client is diagnosed with Meniere's disease after suffering from a viral infection. The nurse recognizes that this condition causes A. Chronic rash, inflamed skin, and encrusted lesions. B. Orthostatic hypotension and swelling of the extremities. C. Altered potassium levels and increased risk of cardiac dysrhythmias. D. Vertigo, tinnitus, vomiting, and hearing loss. Correct answer, D. Vertigo, tinnitus, vomiting, and hearing loss. Meniere's disease is a condition affecting the inner ear that manifests as recurrent vertigo and tinnitus. The client may develop nausea, vomiting, or nystagmus, and the condition may result in hearing loss. The nurse can assist this client by providing a dark and quiet environment and administering medications as ordered to control nausea and vomiting. 18. Mrs. P is being admitted for complications of coronary artery disease. The nurse places her on a cardiac monitor and notes that her heart rate is 210 bpm and occasionally irregular. She is unable to measure the PR interval because the rate is too fast. The QRS complexes are wide. Which of the following conditions does this client most likely have? A. Premature ventricular contractions. B. Atrial fibrillation. C. Ventricular tachycardia. D. Sinus tachycardia. Correct answer, C. Ventricular tachycardia. A client with a heart rate between 110 and 250 bpm with wide QRS complexes may be in ventricular tachycardia. The condition is often caused from complications of coronary artery disease, after an acute myocardial infarction, or through such conditions as hypokalemia or digoxin toxicity. 19. A nurse is caring for Mr. W, who has been HIV positive for 7 years. Mr. W was recently diagnosed with Mycobacterium avium complex, MAC. Based on this diagnosis, the nurse can expect which of the following symptoms from this client? A. Cardiac dysrhythmias. B. Swelling of the lips and face. C. Headache and a ruddy complexion. D. Lethargy and diarrhea. Correct answer, D. Lethargy and diarrhea. An HIV-positive client who develops MAC may show symptoms of lethargy, diarrhea, fever, weight loss, or night sweats. The condition may progress to cause hepatitis or pneumonia as well. Mycobacterium avium complex is a type of opportunistic infection that causes illness among people with decreased immune systems. 20. Based on Mr. W's diagnosis of MAC, which of the following information should be provided to this client? A. He should be started on antiretroviral therapy as ordered. B. He is no longer just HIV positive, he most likely has AIDS. C. He should be tested for other illnesses, such as anemia. D. Both B and C. Correct answer, D. Both B and C. A diagnosis of MAC in a client who is HIV positive occurs when the associated bacteria takes advantage of a compromised immune system. The client's CD4 count has typically dropped low enough that he cannot protect himself from opportunistic infections. Because of this, Mr. W most likely has progressed to AIDS. He should be tested for other illnesses that may develop because of MAC, including anemia or hepatitis. 21. A client begins to choke on food while eating in her room and a nurse is attempting to perform the Heimlich maneuver. After several seconds, the client becomes unconscious. What is the next action of the nurse? A. Continue to support the client's body weight by standing behind her and performing abdominal thrusts. B. Ask a coworker to hold the client while continuing to perform abdominal thrusts. C. Ease the client to the ground and expose the chest. D. Perform a blind finger sweep to remove any objects and begin rescue breathing. Correct answer: C. Ease the client to the ground and expose the chest. A client who becomes unconscious while choking should be carefully eased to the ground before attempting further measures. The nurse should look in the client's mouth to determine if any foreign objects are present that have caused the choking. If the object is visible, the nurse can perform a finger sweep to remove it. 22. Mrs. H has been diagnosed with multiple myeloma. Based on the risk factors associated with this condition, which of the following background information is most likely true for Mrs. H? A. Mrs. H is younger than 30 years old. B. Mrs. H has a BMI of 31. C. Mrs. H is Caucasian. D. Mrs. H has 4 children. Correct answer: B. Mrs. H has a BMI of 31. Multiple myeloma is a type of cancer that develops within plasma cells in the bone marrow. Clients with multiple myeloma develop plasma cell tumors that may occur throughout the body. Those at risk of developing this condition are clients who are older than 40 years and clients who are overweight or obese. A client with a body mass index, BMI, of greater than 30 is considered obese. If Mrs. H has a BMI of 31, she may be at a greater risk of multiple myeloma. 23. Based on Mrs. H's diagnosis, which of the following complications is she most likely to develop? A. Anemia. B. Hyperlipidemia. C. Cirrhosis. D. Stroke. Correct answer: A. Anemia. A client with multiple myeloma is at risk of anemia when increased cancerous cells replace red blood cells. Other complications associated with multiple myeloma include decreased immunity, decreased renal function, osteoporosis, and increased fractures. 24. An 80-year-old patient is admitted with dyspnea, dependent edema, rales, and distended neck veins. As the nurse monitors the patient, he becomes increasingly short of breath and begins to have cardiac dysrhythmias. The most critical intervention for this patient is to A. Ensure his airway is open and unobstructed. B. Apply oxygen to keep his oxygen saturation over 94%. C. Administer dobutamine to increase cardiac output. D. Statin 4 for monitoring of intake. Correct answer: A. Ensure his airway is open and unobstructed. Although all of these interventions are important for a patient with heart failure, an open and unobstructed airway is always the most important intervention if the patient has a palpable pulse. 25. You are caring for a 20-year-old patient with pericarditis. What is the likely cause of pericarditis in a young patient? A. Heart failure. B. Acute MI. C. Hypertension. D. Infectious processes. Correct answer: D. Infectious processes. In younger patients, pericarditis is typically caused by an infection commonly caused by Coxsackie virus, Streptococcus, Staphylococcus, or Haemophilus influenza. In older adults, the most common cause is AMI. 26. Your patient has been diagnosed with acute bronchitis. You should expect that all of the following will be ordered except A. Increased fluid intake. B. Cough medications. C. Antibiotics. D. Use of a vaporizer. Correct answer: C. Antibiotics. Unless the patient has a secondary infection, antibiotics will typically not be ordered. It is important to obtain a chest X-ray to be sure the patient does not have pneumonia, since the symptoms can be similar. Increasing fluids and use of a vaporizer will help liquefy secretions. 27. You are caring for an asthmatic patient with an early phase reaction. Which of the following is indicative of an early phase reaction? A. Rapid bronchospasms. B. Inflammatory epithelial lesions. C. Increased secretions. D. Increased mucosal edema. Correct answer, A. Rapid bronchospasms. Rapid bronchospasms are a symptom of an early phase reaction in an asthmatic patient. The other symptoms are indicative of late phase reactions. 28. Clinical manifestations of asthma include A. Decreased expiratory time. B. Increased peak expiratory flow. C. Increased use of accessory muscles. D. Increased oxygen saturation. Correct answer, C. Increased use of accessory muscles. Clinical manifestations of asthma include increased use of accessory muscles, increased expiratory time, decreased peak expiratory flow, and decreased oxygen saturation. 29. What drives respiration in a patient with advanced chronic respiratory failure? A. Hypoxemia. B. Hypocapnia. C. Hypercapnia. D. None of the above. Correct answer, A. Hypoxemia. In normal people, increased carbon dioxide levels provide the drive for respirations. However, in advanced chronic respiratory disease, carbon dioxide levels no longer provide the respiratory drive. Instead, hypoxia, or low blood oxygen, drive the respiratory effort. 30. Which of the following is not a warning sign that compensatory mechanisms in a patient in shock are failing? A. Increasing heart rate above normal for the patient's age. B. Absent peripheral pulses. C. Decreasing level of consciousness. D. Increasing blood pressure. Correct answer, D. Increasing blood pressure. As compensatory mechanisms begin to fail, systolic blood pressure will begin to decrease. Hypotension is a late and very ominous sign for the patient in shock. 31. How does shock usually progress? A. Compensated to hypotensive shock in hours and hypotensive shock to cardiac arrest in minutes. B. Compensated to hypotensive shock in minutes and hypotensive shock to cardiac arrest in hours. C. Hypotensive to compensated shock in hours and compensated shock to cardiac arrest in minutes. D. Hypotensive to compensated shock in minutes and compensated shock to cardiac arrest in hours. Correct answer, A. Compensated to hypotensive shock in hours and hypotensive shock to cardiac arrest in minutes. It is critical to recognize the patient in compensated shock because you still have time to intervene before the shock state decompensates into hypotensive shock. Once the patient is in hypotensive shock, he will quickly decompensate into cardiac arrest without very aggressive treatment. 32. Septic, anaphylactic and neurogenic shock are all categorized as A. Hypovolemic shock. B. Cardiogenic shock. C. Distributive shock. D. Obstructive shock. Correct answer, C. Distributive shock. The three types of distributive shock are septic, anaphylactic, and neurogenic. 33. Which of the following is true about shock? A. A patient with severe shock always has an abnormally low blood pressure. B. Confusion and deteriorating mentation are indicative of hypotensive shock. C. Patients with compensated shock may be unable to maintain a normal blood pressure. D. A normal blood pressure implies that the patient is stable. Correct answer, B. Confusion and deteriorating mentation are indicative of hypotensive shock. A patient with hypotensive shock will develop deteriorating mental status. Patients can be in severe shock without any change in blood pressure. Therefore, blood pressure is an unreliable indicator of shock status. 34. Signs and symptoms of stroke may include all of following except A. Sudden weakness or numbness of the face, arm or leg. B. Sudden confusion. C. Sudden headache with no known cause. D. Hypotension. Correct answer, D. Hypotension. Hypotension is typically not a sign of acute stroke. Hypertension, extremity weakness or numbness, confusion and sudden headache are all symptoms of stroke. 35. Which of the following may cause coup contre coup injuries? A. Rotational forces. B. Deformation forces. C. Deceleration forces. D. Acceleration forces. Correct answer, C. Deceleration forces. Deceleration forces are those in which the head is moving and strikes a stationary object. Deceleration injuries can include skull fractures, contusions and hematomas, and coup contre coup injuries. In the coup contre coup injury, the brain is injured on opposite sides as the brain first hits against one side of the skull and then bounces back and hits the other side of the skull. 36. Meningitis that is fatal in half of the infected patients is caused by A. Virus. B. Bacteria. C. Fungus. D. Non-infectious agent. Correct answer, B. Bacteria. Bacterial meningitis is characterized by acute onset and is commonly caused by Streptococcus pneumoniae, Haemophilus influenza, Listeria monocytogenes, and Neisseria meningitidis. Bacterial meningitis commonly presents with the classic triad of symptoms: fever, stiff neck, and diminished level of consciousness. Bacterial meningitis is fatal in approximately 50% of all cases. 37. Which of the following may alter the level of consciousness in a patient? A. Alcohol. B. Electrolytes. C. Infection. D. All of the above may cause altered level of consciousness. E. Both A and C only. Correct answer, D. All of the above may cause altered level of consciousness. An acronym that can be used to remember possible causes of decreased level of consciousness is AEAU TIPS. These letters stand for alcohol, epilepsy, or electrolytes, insulin, either hypo or hyperglycemia, opiates, uremia, trauma, infection, poison, psychosis, and syncope. 38. The term used to define uterine bleeding in which there is no menstruation in a 24-year-old woman is A. Oligomenorrhea. B. Amenorrhea. C. Menorrhagia. D. Metrorrhagia. Correct answer, B. Amenorrhea. Amenorrhea is a lack of a menstrual period in a woman of childbearing age. 39. Which of the following diseases or disorders is acute? A. Pneumonia. B. Paralysis. C. Alzheimer's disease. D. Diabetes. Correct answer, A. Pneumonia. Pneumonia is an acute disorder or illness. It is temporary. It comes on quickly and it can be cured. All of the other choices are chronic diseases or disorders. They are permanent, but they can be treated. 40. The major difference between a grand mal and petit mal seizure is that a person with a grand mal seizure will have underscore and the person with a petit mal seizure will not. A. Convulsive movements. B. Sleep apnea. C. Atonic movement. D. Flexidity. Correct answer, A. Convulsive movements. Grand mal seizures are accompanied with convulsive movements. Petit mal seizures do not have convulsive movement, but usually only semi-blinking or staring. Sleep apnea is not associated with seizures. It is a separate disorder. Flexidity and atonia are poor and absent tone. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.